Hi and welcome to today's webinar. My name is Thomas Jew and I'm with Aspirico, leading the iplanit product across Australia and New Zealand, and I'm online today from Sydney. With us today as well, we have Natalie Berry from NZCare. Before we hear from Natalie and her experience with iplanit, I will provide you with some content in regards to Aspirico and the iplanit product. It'll only take a couple of minutes. So Aspirico was founded in 2006 in Ireland by our CEO, Declan Kelly. And now in 2020, we operate across Ireland, the UK, Australia, and New Zealand. Aspirico as a company have implemented more than 125 instance of the iplanit product, and we have around 250,000 logins to the system each month. Many of us who works in leadership and the project management part of the system, many of us comes from the community sector ourselves. The iplanit product itself undergone a significant amount of research before it was launched by Declan and the team. It is and has been from day one been designed around a person who requires support. So it is not a system for time and task. It is not a system to track some of these matters. Really what it does, it's a software that's wrapped around a person who requires support and is to enable them and the team around them to really empower them to bring them forward, to also to include this circle of support, and really have this system in place that allows that work. It's a very person-centered support software, and you will see that and also hear that from Natalie when she goes on about the reasons for getting engaged with the iplanit. It allows for inclusion, for control. It allows for circle of support to get involved as well. And it absolutely enables potential, and it's built to enhance people's supported lives to the absolutely fullest. Service providers, so that could be community service providers, disability service providers, they get involved with the iplanit product for numbers of reasons. It is web-based, so it's accessible everywhere you go. Real-time data, live monitoring. Be very, very value driven. So you will see our values is about transparency, inclusion. So you will see that as well throughout the software. We are linked to local KPIs, local standards, local compliances. So it doesn't matter if you're in the UK or here where we are in New Zealand and Australia. The system is built to be configured. So that's something that a very, very unique part of the iplanit product is that every organization who comes on board has an opportunity with us to configure and build their version of the iplanit system, which is amazing. It's a modular, built on a modular framework, not one size fits all, meaning that we have in the inner circle there, we have the core iplanit, which comes with the suite, and then we have additional modules that can be put in. So what we're doing most of here is the referral module, the person-centered calendar module, event and incident management module are some of the ones that we are working with a lot at the moment. As I said, we're extremely value driven, and our values more times than not really is matching up the organizations that we're working with. So you can see our values there is about evidencing the work that you're doing, about inclusion, transparency, and absolutely accountability from all areas within the software. And Healthcare New Zealand, which NZCare sits under, you can see their values there about excellence, support, and respect. So that was my very short little briefing about Aspirico as a company and iplanit as a product. And I'm now going to hand over to Natalie.
So just a little bit of information about who NZCare are. So NZCare are a national provider of disability support services here in New Zealand. We provide support to over 2,800 people, and we have a workforce of over 2,900 staff. Some of the services that we provide include residential services for adults, children and young people, respite services for youth and children and adults, day services, home and community support services, RIDSAF services, flexible disability support services. We provide support to people with intellectual disabilities, physical disabilities, ASD, and people diagnosed with a neurodegenerative condition. So identifying the need to change. So NZ Care experienced a significant period of growth over 5 years, which increased services by over 300%. All NZ Care services at the time were managed by or through a paper-based system, which required significant manual intervention. It became almost impossible for local managers to maintain all the accurate documentation. So there was no linkages between services, no ability to track, analyse and predict nationally, and we had an absolute reliance on maintaining spreadsheets across areas which varied in quality depending on who was entering them. So there was most documentation was copied, so it was held in more than one place. So there may have been a copy in the residential service, the vocational service, the respite service held in, on the file at the office, and also perhaps, you know, obviously the person with support had a copy and their family and whānau had a copy. So the abundance of copies made us vulnerable for accidental use outside of, you know, using out-of-date plans. And also having paper-based documentation made us vulnerable in terms of privacy breaches. So getting started. So in December of 2014, our Healthcare Board approved a 3-year program of work to implement a new CMS for NZ Care. So the project started in August 2015 with defining a business need, and that's where we found Aspirico through an RFP process. So the project team we established, which we had various people involved in. So we had people from the business, subject matter experts, we had business consultants, trained technical leads, finance leads, training leads, people and culture leads, a change manager and a project manager. So many of us that were involved in this project, it was a first for us. So at the project we met twice weekly, and then we also had one-to-one meetings as a full team. So I think one of the successes earlier on was our relationship with Aspirico. So we met every week with Tim and the team from Ireland. But those meetings are fully packed with actions and reviewing functionality. But you know, absolutely, we have a really good relationship with Aspirico, and I think just their background and sector knowledge and things like that was great and helped us along our way. So what did we set out to achieve? So we set out to achieve a referral process, identified needs process, surveys, calendars, clinical planning, support tasks, funding, budgets, staff qualification, event management, so and incidents, location management. So we, as Thomas said earlier, we sort of chunked it into modules, and that was sort of framed our rollout process. As part of that, we had to roll out computers and internets into our services, which I think was a project in its own right, and it took a long period of time to get that right, because obviously there were business requirements for our devices and internet and what that needed to look like. So, and we also needed to make sure that it was fit for purpose for the people we support and our staffing. So we need to think hard about providing internet to the people we support. So we had many robust conversations within the project team with our quality leaders, our operational leaders, our CIO and ICT team, just to work through all those questions about, you know, what happens if someone accesses the wrong site and things like that. And also providing internet for children and our children's services, obviously, we need to consider that. So one of the key outcomes from doing that was entering into a internet agreement with the people we support and their families, and that also included a detailed privacy assessment. So changing our world. So there are so many questions, as you can imagine, from various business people and people key stakeholders, our staffing team. So what happens if the internet goes down? How do agency access iplanit? How do health professionals access iplanit? What if the computer breaks? People had never used a computer before. We had people that had never used a mouse before. We had to bring our shared services team on board as well, because obviously they hadn't managed a CMS for NZ Care before. So some of the things that helped was that we agreed earlier on in the project that we wanted to NZ Care we call it iplanit. So we basically took our policy and procedure manual and we applied it to iplanit. So we completed computer competency training and self-assessment for all support workers prior to rolling out iplanit. So we knew where to sort of dedicate resources to where needed. We updated our service agreements to ensure people's privacy wasn't breached, and we wanted to be upfront and honest about what information people had access to as well. Each of our homes or services had an internet hotspot just in case the internet did go down, and we had an emergency, which we kept in our emergency kits. Okay, so phase one in rolling out iplanit was we rolled out iplanit to our area managers, service managers, health advisors and administrators, and they were trained and we provided a group overview, and then we did some one-to-one sessions. So the first stage was uploading our current paper plans into the iplanit system, and then we added all new referrals as well. And phase two was rolling out to support workers, so that included services, computers and services, internet. So we got people to access and read people's personal plans, daily notes and incident reporting, and I think that was pretty key, was rolling out plans but also getting them to do things at the same time, become familiar with iplanit. So this is just an example of how we tracked. Obviously being a national organisation, we needed to make sure that plans were being entered and things in it. Just a good tool to make sure everybody was on the same boat and it was monitored nationally. So phase three, we continued our rollout, and so that included some interface between iplanit and our ETL finance system. We rolled out the KPIs. We developed KPIs specific to the organisation, calendar management and capacity management for respite services. The people interface for the people we support, calendar management, qualifications, competencies, and so that was phase three. Training the workforce, the most important thing. So earlier on we introduced a concept in phase three which proved to be successful, which was the iplanit champions. So once the iplanit champions were trained, they provided training to team leaders, support workers, service managers, area managers, health advisors, the people we support, family and their whānau. And we had regular national teleconferences just reporting about what any issues were, what were some of the challenges and what were some of the successes. So I think that's particularly what made it successful for us. So it was, sometimes the champions were area managers, sometimes they were support workers, team leaders. It didn't matter as long as it was something that they wanted to do and be. So just some of the traits of an iplanit champion was that they needed to be grounded in NZ Care's mission statement to provide in partnership with people we support and their family and whānau and advocates. They needed to have a good attitude to cope with difficulties and to help others and to learn. Be willing to accept and respect each other's and appreciate people's differences in terms of their learning styles as well. They had to have the ability to persevere through difficult moments and be determined to achieve the best results. They had to show compassion for others and have the ability to learn from their mistakes, and of course a good sense of humour. So this is just when we rolled out iplanit. We were audited. We had a midpoint audit, which was relatively successful. We had no corrective actions and attained to continuous improvements. So just some feedback from some of the families is that they liked being connected to their family members. They thought it was great that they were able to message our staff directly. they were able to upload plans and just felt more connected with their family member. They felt it was like the same sort of system as in sort of Facebook, and being able to connect with their families. That was, flattering. Like the photos, and they could see every day what people were doing via the media section and seeing photos of their people. So that's it for me. So will I hand back to you?
Yeah, that's
Thomas?
great, Natalie. Thank you very much. You stay on the slide there for a second. We do have a couple of questions that came in during your presentation, and we do have a few more minutes left, so I'll get to them. But look, that was good, Natalie. Last time you and I co-presented together was in Adelaide in November last year. So so it's a bit different this time around. And one of the first questions is probably quite aligned to that, because it talks about the difference. It says here, what is the main difference in you going into a cloud-based system from going to where you came from? So probably where you have paperwork in every area. So what's been the main difference there?
Just that there's obviously one plan, and you can access it from anywhere. So particularly at the moment with COVID and us all working from home, it's been great that we can do that, and we don't have to go through any drive or anything like that. So it's great.
You also mentioned a part of the family's feedback into you guys rolling out the iplanit. You mentioned how families can make contact to support workers and keep update via media. Can you elaborate on that?
Yeah, so that people and their families can message people, so sort of just like an Outlook sort of functionality within iplanit, so they can email people or message people directly. So just about family visits, or if they've got concerns. So staff can email managers, managers can email staff. They can email any person in the organisation that they're connected to. So, for example, if they wanted to email someone's manager, then they can do that as well. So it connects the workforce to the right people as well.
Perfect. And how instrumental were the champions in the success of the rollout? Because you're a very large organisation, so you would assume that they had a crucial role.
Yeah, look, I think they were absolutely key. The first sort of phase, we led it as managers and as sort of business leaders. However, the next phase in involving people and getting them to stand up and present the product, and so it sort of created that belief in it, that their peers were presenting something that they felt was a good product. So I would absolutely, I think that was absolutely key to our rollout. And because of the size as well, the size of NZ Care, we were able to do that relatively quickly within periods of time. It was easier than just one person travelling around the country doing it.
Yeah, absolutely. There's two more questions here, Natalie, to we end up. And look, you did mention support workers may not have the right skill sets in regards to using sort of IT software. So what you obviously identified that quite early in the piece, and you talked about a self-assessment that people were doing. Can you elaborate on that?
Yeah, so people did a self-assessment before they came in, and I think, it was the training session with support workers quite interesting, because they were the people first to turn up, so they turned up early, obviously a little bit nervous, and we had probably 95% attendance to those training, and just making sure that they were comfortable sitting alongside someone that was able to support them to do what they needed to do. But the person that couldn't use a mouse, the workforce that hadn't used computers or anything before, it was they've been able to do it. So it was just there was a willingness to learn, and that sort of support from their colleagues as well to do so.
Thank you. And the last one, which is probably two questions in one. You mentioned developing or getting a team involved in developing and configuring your version of iplanit, and you talked about weekly meeting up with Tim, who is our head developers. And so can you? And the second part of the question is, why did you select iplanit as a product? So maybe the challenges or the project management that you went through developing and setting up your system, as well as the reasons for going with iplanit as a product?
Yeah, so I mean, for NZ Care, we have a shared services that we have access. So it's important to us to have those people on board to work through with them what that needed to look like from a people and culture perspective, from a quality perspective. So it wasn't just the business working on the functionality. It was very much a team exercise to be able to get that functionality looking the way that it needed to look like from a business perspective and meet the various contractual requirements, whether it was sector standards or health and safety requirements. So we worked with teams around that.
Yeah.
And what was your second question?
The reason for selecting the iplanit product?
The reason for iplanit was it's person centric, and the interface it has with families and the people we support.
Thank you very much. So look, Natalie, that concludes our little webinar together, and I'd like to thank you personally for your attendance today, and for everyone else who participated. I'd like to thank you all as well. My contact details and Lisa Walters, who also works with us at Aspirico's contact details, are on the screen there, so you're more than welcome to get in contact with us at any time should you have any further questions. Stay tuned, I would say. We're working really hard at the back end to release version 6 of the iplanit software. So we are expecting within the next couple of months that we will have a really good new look and feel to our product. This is a significant investment putting in from us at the moment that we're very keen to obviously show you as well. So thank you to you, Natalie, again, and thank you to everyone who participated. Bye for now.
Thank you.